Hey everybody, this is Phil. Pretty cool case. Patient had a root canal on number 28 back in 2004. This is not a Carestream periapical, by the way. But about a year ago, patient was having sensitivity in the lower right and was seen by their dentist. Nothing was really seen on the PA here. This is the PA that was captured about a year ago, and patient was sent home with antibiotics. And the patient was fine for a little while, and then roughly a year later was having more pronounced pain in the lower right. And this was the periapical that was taken fairly recently. And you can see there's a radiolucency here towards the apex on the distal aspect of the apex here. So what else do we see here? Well, we can see the root canal was a little bit short. Now, is that radiolucency caused by the root canal being short? Well, we just don't know yet. Is there a fracture? That's also hard to tell. Many fractures are in the area of posts, so knowing if there is a post or not can be very important. So, is there a post? That's also hard to tell just from this PA, and knowing that could affect your decision on what to do for treatment. Okay, what else? We can see there's another radiolucency to the distal, and we can assume that that's the mental foramen based on location. So most likely not a big deal. At that point, the patient was sent to the endodontist, and the endodontist elected to take a CBCT. So here's a 5 centimeter by 5 centimeter scan from the 8100 3D. And I'm in the curve slicing tab, and I want to first try to evaluate if there's a post. So I'm going to look at this view, and I'm going to use my mouse wheel and slice back and forth. And it can be still challenging to see depending on the type of post that's used, but I can start to see that there's a little bit of a junction between the post and the gutta percha. If you have your mouse wheel on MPR, and you can actually make this a little less contrasty, and it can sometimes more easily discern that junction. So you can see that there. So you can pretty much tell right now that there is a post in this root. Okay, I'm going to change the contrast back to default because I want you to see the difference in this next view. I'm going to move to the oblique slicing tab, and I want to look at the axial view and see what we can see here from an overall perspective. I'm going to start coronally and then slice apically. So first we can see that there are two canals on 28. Continue to slice apically. We can also see the low density lesion that was surrounding the apex and towards the distal aspect. But what we can also see as I go back and forth is a low density area into the furcation of number 28. So that's actually a pretty key point to what we're trying to diagnose. Okay, so now let's look at our other views. We're going to change the angle of this slice like so. Going to move this, and we're going to focus on our view down here. So now I'm going to make this a little less contrasty again, and this can be helpful when trying to find a fracture. Thank you, Dr. Al Matney, for that little tip. So I'm going to make this a little less contrasty. I'm going to zoom in some more. And now I'm just going to scroll back and forth using my mouse wheel. And right here, we can actually see a fracture. Not just this junction, but you can actually see the fracture going across the root. So let's take a look at this view and see if we can also see the fracture over here. I'm going to change the angle of my slice a bit. Move this over here. So now we can actually see the two roots. And I'm now going to use the mouse wheel again, back and forth. And we can see the low density lesion surrounding the apex and also into the furcation like we saw from our axial view. And now we can also see the fracture Again, not just the junction, but we can see the fracture line going through the root and into the area of the low density lesion in the furcation. So a lot to think about here. How long did the patient wait for an accurate diagnosis? Hopefully a retreatment wasn't attempted on this tooth. Could this have been diagnosed and treatment planned for an implant a long time ago? All questions to think about and ponder, but a great example of using CBCT for an accurate diagnosis and treatment plan.